These videos have been developed for instructional purposes. For this reason, the nursing students and nursing instructor review the steps of the skills at the bedside. In actual nursing practice, you and your instructor should decide if this approach is appropriate for you.
So why are yawns contagious?
I have no idea.
Miss Scott, you're supposed to know these things.
Well, yawning, I don't know about, but I do it very well.
Why are you late night?
Coffee. No. I just couldn't fall asleep last night.
Oh, man.
You ever have one of those nights?
Oh, come on. Maybe you just drink too much coffee, Mark.
Oh, there's one thing that you shouldn't blame it on. That's a good cup of coffee. I could have been up thinking about many things, but don't blame my favorite thing on this whole planet.
You know, he was thinking. That's scary.
Are you going to be okay, Mark?
Me? I'm fine. Why? What's on tap for today?
Okay, let's get started. Well, today we're going to focus on medications, both oral and topical. Can anyone tell me the most common types of medications?
Well, oral medications are generally the most common. Oral medications are those taken by mouth and absorbed in the stomach or in the small intestine.
Go ahead.
Also, topical medications are fairly common. These are meds applied to a body site, such as the skin or in a cavity. Examples include suppositories, drops for the ears and eyes, and transdermal patches.
Very good, good. Now, some things you want to remember when administering medications. First, be sure to prepare meds for only one patient at a time. Now, this would avoid confusion and error. And never leave prepared medications unattended. Okay, you should also check for incompatibility between the different medications the patient is taking, as well as assessing the patient's allergy history. Okay? What else?
Well, we should always make sure we've identified the patient correctly before administering. The person who prepares the medication should be the same person who administers it, and also the same person who documents the administration.
Excellent. Yes. Now, before we begin, I want to make sure that we're all clear on the 3 checks and the 5 rights to patient administration. 3 checks. Mark, go for it.
All right, 3 checks.
Okay.
That's when you check the medication label 3 times while preparing a medication. First check is when you get the medication or the dosage package.
Good.
Second is right before you put the meds in the medication cup or right before you pour liquid medication. And third, and finally, is after all the medications have been prepared, right before you bring it to the patient.
Good, good. Melissa, what are you looking for when you perform the 3 checks?
The 5 rights of medical administration.
Okay.
So when I am rechecking the medication against the MAR 3 times, I am looking for the right patient, the right medication, the right dose, the right route, and the right time.
Good.
All on the right hand.
All on the right hand. This ensures accuracy when administering medication to the patient.
Excellent, both of you.
Thank you.
So, Mark and Katie, I'd like for you to begin with your patient care while I work with Melissa, and I'll catch up with each of you later, all right?
Okay, very good. Thanks.
All right.
One more sip, I promise.
You can't take that out on the floor, you know. So my first patient has a number of prescribed oral medications as part of her plan of care.
Good. I'll observe you as you prepare the medication.
Okay.
Now, keeping in mind what we discussed earlier, what was the first step?
Well, first I checked the original medication order on the chart with the medication administration record. That's when I clarified any inconsistencies and noted any allergies she has to make sure she's not allergic to any of the prescribed medications.
That's correct. And don't forget
The 3 checks and the 5 rights.
All right. Now, start by unlocking the med card. Very good. And remember, we only prepare medications for one patient at a time. And in addition to checking the medication's expiration date and calculating the dosage, you should also take care to separate any medications that require special considerations or assessments.
So, according to the MAR, my patient's first medication is one multivitamin tablet, PO, or by mouth daily. So I pick the appropriate package out of her medication drawer.
Right. Now that's check 1. Now check 2 is to compare the package label to the MAR again.
Okay, so should the unit wrapper be opened now or when you give it to the patient?
Well, the medication should remain in the unit dose wrapper until it is given to the patient.
Okay. Next is 0.125 milligrams of Lanoxin PO daily.
Check 1.
Check 2 is to compare the medication label again to the medication administration record.
Okay. Very good. You're exactly right in placing this Lanoxin in a separate cup because before this medication can be administered, you'll have to check the patient's apical pulse rate for 1 minute.
Right.
Good.
And according to the order, I should withhold the medication if the apical rate is less than 60.
And if it's less than 60, we notify the physician.
Okay.
Okay.
So the last medication she needs is 20 milligrams of furosemide.
Okay. Can you get that out? Okay.
And check 2. The furosemide can be placed in the same cup with the multivitamin because, according to her chart, her blood pressure and serum potassium levels are within normal levels.
Yes. Yes, they are. Good.
Okay, so these are all the medications that she needs at this time.
Now, after all the medications for the patient have been prepared, you should check the 5 rights for the 3rd time before taking the medications to the patient. So let's do that now. Good.
Okay.
Good. There we go. And don't forget to lock the card.
Okay.
Very good.
All right, we're all set.
Let's go see the patient.
Good.
Hello.
Hello, Mrs. King. How are you this morning?
Feeling a little better, thank you.
Good. I'm glad to hear that. Hi, my name is Andrea Scott. I'm a nursing instructor. And this is Melissa. She's a nursing student who will be taking care of you this morning.
Good morning, Ms. Keene. I'm going to be giving you your medication, but first I'd like to check your ID band. Is that all right?
Sure.
Can you tell me your name?
Alice Keene.
Now, according to your chart, it says here that you don't have any known allergies. Is that correct?
No, not that I know of.
Okay, great. I'm going to check your heart rate first before we give you the Lanoxin.
Okay, fine.
Also, Melissa, it's very important that Mrs. Keene is aware of the action, purpose, and side effects of her medication.
Oh, you're going to give me a vitamin, a water pill, Lanoxin, right?
That's
you know,
right.
I've been taking these every morning, first thing in the morning for a while, so I know all about these.
Very good. Very good.
Okay, great. So we're going to get right to checking the heart rate then. No additional questions?
No, thank you.
Okay.
Thanks for asking.
Sure. I'm just going to put this down here.
Make sure you have the right
be
placement.
away.
Good.
Okay.
Very good.
All right. Okay. Everything sounds good. So we're going to get right to giving you the medication now. Now, would you like me to place it in your hand or put it in the cup?
No, the cup is fine.
Okay, good. Okay, so we're going to start out with the Lanoxin. Put it in the tiny cup here. Here you are. Here's the Lanoxin. And
Thank you.
Get you some water.
All right.
All right. Okay,
Thank you.
Okay, now I'm going to give you the other two. The multivitamin here. The furosemide.
Okay. Okay.
Now, it's important that you remain present until all medications have been administered and swallowed, and you should wait to record the medication in the MAR until after you witness the patient taking the medication. Okay?
Okay. Here we are, all finished.
Okay. Now, once the medications have been administered, you should be sure to dispose of any medication wrappers and make a record of the fluid intake if it is being measured. You'll also make sure to document all medications given on the patient's medication record along with any necessary assessments according to facility policy. You are doing just fine, Mark.
Thank you.
Do you have any questions?
No questions.
Okay. Let's see what we have here. Mark, your patient has been prescribed 325 milligrams of aspirin to be administered once a day orally. Now, it's packaged in a bottle containing multiple doses of aspirin. Can you tell me what's the proper procedure for preparing one dose?
First, I would check the MAR for accuracy.
Okay.
Then I would select the right bottle from the cart.
Well, actually, you don't need to do all that right now. You know what you need to do?
What's
Give
that?
some hand hygiene. Let's move out. Go wash your hands.
Okay.
I don't think it's necessary to do all that until you wash your hands.
Now I can check the MAR.
Now you can check the MAR.
Now I can check the MAR.
All right.
And I select the right bottle from the cart.
Good. That's check one.
Let's check one.
Okay.
Next, I compare the MAR to the bottle.
Check two.
I check the expiration date. And finally, I do any drug calculations as necessary. And finally, I pour one aspirin into the bottle cap and then into the disposable cup. 1, 2, 3, 4. That's okay. So should these be discarded? Or?
No, that's not necessary.
Okay.
The extra tablets can be returned back to the bottle.
Oh, really? Okay.
Yeah.
All right. Okay, so now I put the tablet I need into the disposable medicine cup.
You'll do the third check of the label, comparing it with the medication administration record before returning the bottle to the drawer. And then you'll be ready to administer the aspirin.
Okay, gotcha.
Okay.
Looks good.
Katie, sometimes the dose specified in an order is different from the dose contained in the provided tablet. So it may be necessary to break the tablet to obtain the right dose. Now, your patient's doctor has prescribed 2.5 milligrams of prednisone for the patient to be taken in the morning with food. However, the pharmacy has provided prednisone 5 milligram tablet.
Well, in that case, the tablet should be broken in half in order to give the right dose.
Right, but keep in mind only scored tablets should be divided because this ensures an accurate dose. Now, you may need to do it yourself, as in this case, or the pharmacy may break the tablet before dispensing to the patient's supply.
Okay.
Okay?
Well, first I'll check the MAR. Then take the medication from the cart.
Good.
And compare it to the MAR. Then I'll check the expiration date and perform any necessary drug calculations. So since the prednisone is a 5 milligram tablet and the patient requires 2.5 milligrams, breaking the tablet in half will give me the right dose of 2.5 milligrams.
Good. Now, there are two ways to break tablets. You can either split them at the score, or you can use a pill cutter.
I think I prefer the pill cutter.
I think that's a good idea. You'll find it there in the top drawer.
Okay.
Good. Okay. So what do you do now?
So now I'm going to put on gloves.
Good.
And next I remove the medication from the package. Then I check the package against the MAR. That's my third check. I put half of the tablet in a cup for the patient, and I discard the other half. I can take my gloves off now because I won't need them after this point.
Good. Then the medicine would be administered to the patient.
Great.
Excellent.
Melissa, your patient is to receive 400 milligrams of guaifenesin, which comes as a liquid medication. Can you tell me what's the procedure for preparing liquid medications?
Okay, you can prepare small volumes of liquid medication using needleless syringes or graduated liquid medication cups.
Okay, so let's use the graduated medication cups.
Okay, so first I check the MAR. Then I get the medication from the cart. The physician has ordered 400 milligrams of guaifenesin to be administered at 8 a.m. So, according to the bottle, there's 400 milligrams per 10 cc. So that means that I'll be preparing a 10 cc dose.
Exactly.
Okay, so second, I check to compare the medication label against the MAR.
Right.
I check the expiration date and make the drug calculations, which I've done.
Okay. So now you're ready to prepare the dose.
I'm going to put the graduated medication cup on a flat surface and move so that I'm at eye level with the cup. I read the medication amount at the bottom of the meniscus as I pour. So,
Okay, good.
here goes.
All right. Good. Now, just be sure you wipe the lip of the bottle with a paper towel after you pour the medication. You see, when liquid drip onto the bottle, it makes it hard to read the label.
Right.
Good.
All done. Now I compare the bottle once again with the MAR. It's my third check before I put it back in the medication cart. And I'm ready to administer to the patient.
Right you are. Good work.
Thanks.
Okay. All right, now, Mark, let's talk some more about transdermal patches. Can you tell me what are the specific considerations to keep in mind with this type of medication?
You should remember to inspect the skin and patches that are already in place. And you also have to remember to rotate the application sites when you change a patch. And make sure that the skin is clean, dry, and free of any hair. And any existing patches need to come off when applying new ones. You shouldn't apply a patch to any open or irritated skin.
That's right. Good, good. Why don't you tell me about your patient? Why does he need a patch?
Well, he's a smoker.
Oh, that's reason enough.
And since he's not allowed to smoke in the hospital, he's been given a nicotine patch to help control his cigarette cravings.
Okay. Now, remember, you're going to wear gloves when removing and replacing patches to prevent contact with the medication because you don't want it to absorb into your skin. So tell me, what would be your first step?
Well, I would compare the medication order with the original order and review the chart for any known allergies.
Good.
And I would start with the first check, reviewing the MAR.
Good.
So the MAR calls for a nicotine transdermal patch, 21 milligrams a day.
Okay.
So I take the medication from the drawer. I compare the label to the MAR, 21 milligrams a day. I also check the expiration date. That's good. Now I do any drug calculations that are necessary. And since he's not giving any other medications at this time, this is all we need. So I do the third check, and I compare it one last time to the MAR. And now I just get my patch, and we're ready to see my patient. Good morning, Mr. Shepard. How are you today?
Mr.
I
Shepard?
smoke.
Well, like we discussed yesterday, I'm not allowed to give you any cigarettes, but I do have a new nicotine patch for you.
Well, patch isn't quite the same as a smoke, but I guess it is helping.
Oh, well, that's good. I'm glad to hear that it's helping. I do have a new one to apply. You just let me take a look at your ID bracelet. Okay. Thank you. And what's your name, sir?
Bob Shepard.
All right, Mr. Shepard. Are there any known allergies that I should be aware of?
No.
When replacing transdermal patches, the first thing you want to do is locate and remove the old patch.
All right, great. Well, then let me just take that old patch off and get you hooked up with the new one.
Okay.
So did you see the game the other night?
Oh.
So, Mark, check the skin for any type of irritation. And now you want to dispose of the old patch by folding it in half, pressing the adhesive sides together, and then just discard it. Good. All right.
That's good. Now I just take out the new patch from the packet.
Good. Right now you need an indelible pen to write the time and the date
right on top of the patch.
All right.
Okay. Also, record this information on the patient's MAR. Okay?
Mm-hmm.
Good.
Okay, so I remove the plastic backing from the medication, making sure not to get any medication on my hands. And now I apply the medication to a different side of the body, pressing firmly around the outer adhesive edges for 10 seconds.
Okay. Very good. No, Mark, don't rub it or massage the site, because if you do, you might release a bolus of medication in the patient, and that can be dangerous.
Okay.
Okay?
Yep. There you go, Mr. Shepard.
Thanks.
Okay.
You're welcome.
Now what you want to do is dispose of the packaging. Good. And your gloves. And you want to clean your hands. And then you want to record the medications given on the MAR. Goodbye, Mr. Shepard.
Okay.
All right, you're set. See you later, Mr. Shepard.
Hey, you sure you don't have a smoke on?
No, I'm sorry, I don't. Hey, you never know, Mr. Shepard. Maybe not smoking these next couple days may help you quit. It's a lot healthier, too.
You know, you may be right.
I'll see you. Have a good day.
Okay.
Hi, Katie.
Hi.
So, Katie, tell me about your patient.
Well, my patient needs eye drops for her glaucoma treatment.
Okay.
She says her daughter usually does it for her at home,
Okay.
and she's asked the nurses to administer them while she's here. Oh, her doctor also ordered eardrops to treat an infection in her right ear canal.
Alrighty. So tell me this, what supplies will you need for all this?
Right, I need the MAR,
Good.
cotton balls and gauze squares, saline solution for the eyes and the ear,
Okay.
and a clean pair of gloves.
So what do you do to get started?
Well, I've compared the MAR against the original medication order,
Okay.
and I reviewed the chart for any allergies to the medication.
Okay, right. And what is your first check?
My first check is to read the MAR and select the correct medications. Let's see.
Okay.
She's to receive 2 drops of pilocarpine hydrochloride in each eye and 4 drops of acetic acid in the right ear canal. So I'll start with the eye drops.
All right.
Pilocarpine hydrochloride. This matches the MAR and the expiration date is valid.
Good.
Put that there. Okay, so now the second medication. Acetic acid. This matches the MAR and the expiration date is next year.
Good, good. Now what's next?
Well, normally I would also check the dose calculations,
Yeah.
but that's not necessary this time since I'll have to measure the doses and drops at the patient's bedside.
Okay.
I have all the medications that I'll need, so I'll just check the information for the 3rd time,
All right.
and then I'm all set. I won't need this.
Okay, so let's check it for the 3rd time.
Pilocarpine hydrochloride, acetic acid.
Good.
Great.
We're all set.
Hi, Ms. Thompson. My name's Katie. I'm a nursing student, and I'm going to be helping to care for you today. This is my instructor, Ms. Scott.
Miss Thompson. Hi.
So I'd like to give you your eye drops and also some medication for your ear infection.
Thank you.
Sure, and I'm just going to warm up those eardrops with a little warm water. Here we are. First, I'm just going to lower your armrest.
Good.
Raise your bed a bit. You comfortable? Good. Get my gloves on here. Now I just need to inspect your ID bracelet. Okay, can you tell me your name?
Barb Thompson.
Great. Next, I'm just going to clean your eyelids with a bit of saline solution. It looks like you have a little drainage.
Okay, there you are. You should move from the inside of the eye to the outside. And remember to use each area of the gauze only once.
Okay.
Very good. And only once. There.
Great.
Okay?
Looks good. Okay, the other eye.
Yes.
Now I'm just going to need you to tilt your head back slightly. There you go, great. And is it okay if I touch your head? Yes. Okay. And I'm just going to have you look up and focus on a spot on the ceiling. Okay, great.
Okay. To apply the drops, Place the thumb or the two fingers near the margin of the lower lid, just below the eyelash, exerting pressure downward on the bony prominence of the patient's cheek. Now, this will expose the lower conjunctival sac. You see it?
Yes.
Good, good.
Okay, now, Ms. Thompson, I'm just going to ask you to keep focusing on that spot on the ceiling so you keep from blinking.
Now, move the dropper closer to the eye, but be careful not to let it touch the patient's eyelid or the surface of the eye. Okay, now squeeze the container, allowing the number of prescribed drops to fall into the conjunctival sac, but do not let the drops fall into the cornea.
Okay.
Good. All right?
1. Good job. Yeah, keep focusing on that spot. 2.
Miss Thompson, you can wipe that off with a tissue later, okay?
There you go.
Okay.
You got your tissue there? So what I'm doing now is just applying a little bit of pressure to what's called the inner canthus.
Good.
And that'll keep any of the drops from flowing into your tear duct. Great. You can keep your eyes closed if you like and just wipe some of that extra off. All right. Now the other eye. Just do that real quick. Great.
Good.
Now remember, Ms. Thompson, not to rub your eyes, okay? And next we're going to administer the ear medication. So I'm just going to help you to roll over onto your side so we can expose your infected ear. So if you just roll this way a little bit. Good. And I'm just going to lower the head of your bed for a moment. Great. Okay. So I'm going to clean off some of the drainage around your ear with a little bit of saline moistened gauze. Okay. Great.
Good job, Katie. Good.
Great, thanks. Okay, so I've got the eardrops here.
Now, is it warm enough?
Yeah, they do feel warm.
Great.
Great. Now, Ms. Thompson, you may feel a little pressure on your ear as I pull up and back just to straighten out your ear canal.
Now, hold the dropper in the ear with the tip just above the auditory canal, but be sure not to touch the skin.
Got it.
Just like the eye drops. Squeeze the bottle to give the prescribed dose and let the drops fall on the side of Miss Thompson's canal.
Okay.
Okay. Now, once you're done, you can release her ear.
Okay.
Good.
Now, Ms. Thompson, I'm just applying pressure to your tragus to help the eardrops move from your ear canal to your tympanic membrane. Okay.
And don't forget that Ms. Thompson's doctor has instructed that a cotton ball be inserted loosely in the ear canal, and that's to prevent the medication from leaking out.
Okay.
And remember, if both ears require drops, you should wait at least 5 minutes before administering it into the other canal.
All right, I'm all done, Ms. Thompson. I'm just going to raise the bed back up to a more comfortable position for you.
Good.
And put this bar back up for you.
Yes. Okay.
Take care. Okay.
Okay.
Oh, let me mark this down
Yes.
before we go.
Hi, Melissa. You're ready to prepare the medication for your patient?
Right, just waiting for you.
Okay.
My patient has a temperature of 101, and since he can't receive any oral medications, the doctor has ordered a 650 milligram acetaminophen suppository every 6 hours for a temperature greater than 100.4.
Good. Okay, can you tell me some of the important things we need to consider about suppository?
Well, if there is feces present in the rectum, the suppository should be placed in between the stool and the mucosal wall and not into the stool.
Okay, sounds like you're up to speed. I tell you what, let's go in the prep room, prepare the medication, grab the lubricant, and then we'll go see the patient, all right?
Okay.
Okay, you're doing well. Come on.
Hey, Mr. Lummett. How are you? This is my nurse instructor, Miss Scott.
Hi.
And I'm here with another suppository for you for your fever. Is that all right?
That's fine, Melissa.
Okay, great. Let's check your armband. Can you tell me your name?
Max Lummett.
Okay. And do you have any allergies?
I sometimes get a little sniffly around cats, but other than that, none to speak of.
Right. I have a dust and pollen thing, so it's always like carpets and flowers that get me. So I'm just going to check your information here with your medication. Okay.
Good.
And we're going to push this out of the way so we can get you comfortable, all right? All right. How's it been so far? Just stay here.
Fine, so
Nice,
far.
they're treating you good. Okay, so I'm going to need you to turn over onto your side. All right. Okay, good. This one we do.
Now remember to generously lubricate both the suppository and your gloved finger, okay?
Okay, so I'm going to touch you now, Mr. Lemon. I want you to take a few deep breaths through your mouth, and then I'll insert the suppository.
Okay. Now, with your index finger, insert the suppository beyond the internal sphincter. And that'll be about 4 inches in adults and 2 inches in children and infants, okay?
Okay, great. All finished, Mr. Lemon.
Okay.
We're just going to get your cover back over and have you roll over. Now you're going to need to remain still for the next 5 minutes just to allow the medication to absorb. And the suppository has to remain in place up to 30 to 45 minutes, so try not to go to the bathroom. So here's your call button right next to you if you can see it there. And, just give us a call if you need anything, and I'm going to come in and check on you later to make sure that the medication is working and your fever is dropped, all right? All right.
Okay. You did well. Hope you feel better.
Just going to chart here.
Okay, you're going to be on the MAR.
So we'll let you rest. Thanks so much.
Hi.
Take it with a grain of salt.
Or
take
you
your
stick
grain
out
of
like a
salt.
sore
What is
thumb.
this about getting a goat?
And does anybody really stick
Okay.
out?
Listen, let's get back focused here. Listen, y'all did a good job administering your medications today. I'm very, very proud. But I just want to take a moment to talk about some situations that could arise that you may not anticipate. Okay, Mark, let's say, okay, here we go. What would you do if a pill you were giving a patient fell on the floor?
Well, the 5-second rule, you can still give it to them. No, I'm kidding. I'm kidding. There is no 5-second rule. If the pill falls on the floor, it is wasted and it can't be used. Then I would discard it according to policy. And then I would identify what medication it was and get a replacement medication.
But what if you can't tell what the medication is?
If you're unable to identify the medication or in doubt, just consult the pharmacist for proper identification. But you should administer the missed dose as soon as possible. All right? Okay, let's move on. Moving on. Katie, different scenario. You arrive in a patient's room with his routine medication, but...
Mr. Buckley? Mr. Buckley?
I'm in the can.
Oh, I have your medication for you.
Well, I'm going to be a minute. Just leave it by the bed and I'll take it when I'm done.
So, Katie, how would you handle this?
Well, thanks, Mark. I guess I wouldn't just leave it because someone might tamper with it.
Okay.
Or it might get thrown away, or even worse, someone else might take the medication by mistake. And I'm, personally responsible for making sure that the patients actually swallow the medication, so I'd need to be present at the time. Okay. So I guess what I would do is... I'll come back with the medication in a few minutes, Mr. Buckley. Just ring the call bell when you're ready.
Okay, that sounds good.
Okay.
Well, that's the response I was looking for. Okay. All right, Melissa. Say you prepared a patient's medication, and after checking their ID band, the patient says,
"What's this? This doesn't look like the pill I took yesterday. Yesterday was a green pill. This isn't a green pill. Where's the green pill?"
Well, this is your iron supplement, and you are to take it with each meal.
"But this isn't what I took yesterday. This pill is red. The pill I took yesterday was green. Very green. I've never taken a red pill. My pills are green."
Well, I would recheck the package against the MAR, and then I'd recheck the administration time, and then recheck the MAR with the original order on the chart. Okay. Now, if the patient continued to insist, or I still had some concerns, then I would consult his doctor and make sure that this is in fact medication he should be receiving, and just clarify the order.
Exactly. So does anybody have any questions? No? Well, good work today. I'm proud of all of you.
Great.
Good. Remember to review all the skills we've covered and consult your texts. And if there are any questions, I'll just see all of you tomorrow.
Okay.
Okay?
Thanks.
All right. Have a good night.
You
Get
too.
home safe now.
You too.
Okay.
You guys can just go ahead. I'm just going to grab one quick cup before I go.
What do you need that for? You're going home now.
See, that's the cup you shouldn't have.
Right.
Yeah. Whoa, I'll fall asleep on the bus.
Okay, well, just read a magazine or, listen to music or something. Don't drink a cup of coffee.
Fine.
You're going to regret it.
Okay, fine. But if I wake up 50 miles from my house because I fell asleep on the bus, you're both going to have a surprise tomorrow morning.
All right. Oh, we're scared.
Yeah.
Oh, no. Mark's, get out.